What am I doing here? I'm rotating, yeah? Okay, technically with my arms here, I am pronating in, supinating. Okay, then how would I circumduct? You see the difference? I'm rotating, and now I'm circumducting. Circumduction creates a cone. A point here, and a larger piece over here. Circumduction makes a cone. So you can circumduct with other joints. Okay, so circumduction creates some confusion. These don't create any problems. Those don't create any problems. That doesn't create any problems. That doesn't create any problems. Protraction and retraction. From what you just saw of the joint, what enables this to happen? What articulation allows protraction and retraction? What, Miranda? Okay, right, but give me the anatomy explanation.
Cartilage disc.
Yeah, the cartilage disc in there. What is actually happening when the jaw is protracting and retracting? The condyle is moving anterior and posterior in the joint cavity. All right, good. There's a question.
Yeah, I was going to ask, these PowerPoints that you added on, are they uploaded?
Yeah, they're on the previous presentation that I skipped when I was going through it.
Okay.
They are online, yeah. Okay, now the last part of this is going to be all these attachments on the tibia and fibula. So we've already talked some about this stuff in the knee joint here, and we'll stick things on the end of these bones as well. Review very briefly with me the names of the bones. This is going to be important. The calcaneus is the heel. What bone articulates with the talus? The tibia. So you are standing right now. I'm standing right now. Femur on tibia on talus. That's how I'm standing right now. Okay, and then if we work our way anterior, students don't normally miss this. The navicular is medial and the cuboid is lateral, right? We'll import it in just a second because we got this weird one, this fibularis, that actually goes underneath the cuboid all the way over to digit number 1. It's supposed to extend, but it flexes. It's crazy. All right, so the talus here, the navicular and cuboid, and then all three of the cuneiforms. Medial, intermediate, and lateral cuneiforms. Those are the tarsal bones of the foot. And then the metatarsals and phalanges. Just as a note here of reminder, I always ask this question. Remember, y'all, that the hallux, right? And the pollex each have 2 phalanges. A proximal and distal. All the rest of them have 3. So you expect, if you just think phalanges as a 3-bone scenario, you think, there must be 60 of these in the body, but how many are there really? 56. Yeah, so don't miss that. There's only one of those phalanges, only 2 of the phalanges on the hallux and the pollex. All right, now, we did that already again today, so let's look at them. All right, so I'll ask questions, as I told you on the last online thing. I like to ask questions that help students remember the big picture. Let me say this again. I am not good. I've been teaching this stuff for 2.5 decades, and I struggle every year trying to remember digits 2 to 5 and 3 to 6 and 1 and transverse, and after a while it just is crazy. And here's what will happen if you're normal. Now some of you are not normal. I'd be willing to admit that. But if you're normal, then by the time the Christmas holidays are over, all of that stuff will be gone. But I would like for something to remain. Some big picture ways of describing things. And so whenever I test, on your test on Monday, I promise you that being able to distinguish 2 to 5, 3 to 5, 1 to 4, all that, will not cost you an entire grade level. Less than 10% of your exam will detail that kind of thing. It will be more focused on questions like this. Can you name the muscles from medial to lateral? can you name the muscles from anterior to posterior on the crural region? Because that's something you can remember. All right? Now, it's not that I'm not going to ask you attachments. It's not that you're not going to have to know them at least for one day on your lab exam, right? That's the nastiness of the lab exam. But I'd like for you to take something away from anatomy with you, so I try not to punish you any more than I'd want to punish myself. I like to be able to read my exams and go, I think I could get all those questions right. I expect myself to be able to do that, and my students are going to be able to do it. Okay, so here they are from anterior to posterior. All right, in order. These are the ones exactly like they are in the cat. And they are, number one, the tibialis anterior. Number two is the extensor digitorum longus. Number three is the fibularis longus. Notice that it is not numbered on this picture. Annette, why do I not have the fibularis longus labeled on this picture? That's right, because it's not a dorsiflexor. It's a plantar flexor. Exactly. So, tibialis anterior, extensor digitorum longus, fibularis longus, soleus, and gastrocnemius. If you look at the side of a leg of a cat, if you look at the side of the leg of a human, it's going to be the same. Those are the muscles in order from anterior to posterior. Now, these are labeled, I'm going to pick up two more now. These are labeled in order to emphasize to you what the muscles do. The first two here, the tibialis anterior and extensor digitorum longus, both dorsiflex. And the other two major dorsiflexors are also labeled here. I'm going to penetrate a little bit deeper here, so I'm going to give you all of it. The other two major dorsiflexors that you can see in this picture are the extensor hallucis longus and the fibularis tertius. Now, can I just point something out to help you try to remember this? Notice that there are 1, 2, 3 muscles in the leg below the knee named fibularis. A lot of textbooks, y'all, are going to call these the peroneal muscles. This one will be called the peroneus longus, the peroneus brevis, the peroneus tertius. And you learned that in the opening days of anatomy. Where's the peroneal region? On the side of your leg, distal to the knee. Okay, so the peroneal muscles here. All right, so also notice this. The tertius is the only peroneal muscle that dorsiflex. The main job, the main mass of the peroneal muscles is to plantar flex. Okay, so do that again. So tibialis and extensor and fibularis. Let's look at them closer. Here they are. This is a good picture because you can actually see where they're attached. So the tibialis anterior is on the proximal tibia. It goes to the medial cuneiform. Now this is also a phenomenon we see a lot in this part of the leg. The tendons that have single tendon attachments like to cross over to the other side. They really like to go, except there's a couple of exceptions to this. Most of these guys like to go toward the big toe. So if you have to guess on one, he goes to the first digit. All right, so this one, the medial cuneiform and the first metatarsal. Then we had, what was next on the list? Anterior, posterior. Y'all are learning it with me. Again. Tibialis anterior, extensor digitorum longus, fibularis longus, soleus, gastrocnemius. That's the order. All right. So now, from the tibialis anterior, the next one's this one, right? Extensor digitorum longus. And this one attaches to the lateral, proximal, tibia, and fibula, and goes to digits 2 to 5, to the phalanges 2 to 5, on the top. So this is why it dorsiflexes. And the last one, the tertius, goes from the fibula to the 5th metatarsal. So you can see it coming here. It's a small muscle underneath the longus, the fibularis tertius. And I don't believe it's labeled in your lab manual. We didn't have to find the tertius. Okay, but it's one of the major dorsiflexors, and so you need to know its attachments and its innervation. All of the dorsiflexors now that you've learned, the four that you've learned, dorsiflex and get fibular innervation. Fibula, dorsiflex. All right. Now, the next two here that are weird ones, these are the ones that go, you've got to be kidding me, right? These guys right here do plantar flexion to get fibular. So in our order, we had tibialis anterior, extensor digitorum longus. The next one was the fibularis longus, but I didn't talk about that one yet. We didn't look at it. It does get fibular, but it is bizarre because it actually does plantar flexion. Let me show you why. The fibularis longus here is also attached to the first metatarsal, right, and the proximal fibula. But you see the big arrow and the asterisk here? This is saying, Wade, point this out to them. You need to be able to explain why the muscle that's right next to this one, the extensor digitorum longus, dorsiflexes, and this one plantar flexes. And here's why. The tendon, as it approaches the ankle, passes laterally to the calcaneus here, and you can see now, this is the bottom of the foot. It then crosses the sole of the foot and has a little attachment to the medial cuneiform right here, but most of its attachment here is on the first metatarsal. It is a muscle on the peroneal side. It is peroneal. It is fibularis. It looks like, because it's right next to the extensor, that it would extend, but it doesn't. It passes under your foot and attaches here. So when it contracts, it actually pulls your big toe down. So it is a plantar flexor, but it also gets fibular. It's right where you would get fibular, right? Tibialis anterior, extensor digitorum longus, fibularis longus, they're all right next to each other. Makes sense it gets fibular, but this one does the opposite motion, as does this one, the fibularis brevis, which goes from the fibula to the fifth metatarsal, also does plantar flexion. All right, the last of this is the muscles really that we should consider as part of the posterior compartment of the leg. There really is no anterior compartment. It's really lateral and posterior. It's a bone on the front. Okay, and they are, first on the list here, shown here in the picture, is the plantaris. Now this one's tricky too, right, Annette? We had to fight with this one, and I told her, I said, tomorrow we're going to see this in class. I keep picking on her because she helped yesterday me as I was helping her think about the craziness of these muscles again. And so the plantaris that you find here doesn't look like that in the cat. Help us, Annette. How is it different?
It's a lot bigger.
It's a lot bigger in the cat, yeah. So we're going to see it here in just a moment, attached to the lateral condyle of the femur. And then it's this weird thing in humans. It's just a stringy tendon that runs down with the Achilles tendon. In the cat, it is fused, a muscle that is fused to the lateral head of the gastrocnemius. So you could peel it away and see a shiny, glistening tendon on it related to the plantaris. All right, the big ones on the back of the leg are the gastrocnemius lateral and medial heads, and they go to the condyles of the femur. They go all the way up through the knee joint and attach to the condyles of the femur, and then to the calcaneus by way of the all-famous calcaneal tendon. We call that Achilles tendon, yeah. And so these two heads right here, the medial head and the lateral head of the gastrocnemius, and this one, which is just deep to it, the soleus, are oftentimes in textbooks referred to as the triceps surae. So these are the triceps of the leg. Tri means three. So what three are we talking about? Medial lateral head, gastrocnemius, and soleus. These are the triceps. Now, notice what I just told you just a second ago. This one, the plantaris, attached to the lateral femur, also joins the calcaneal tendon. And so in your cat, that's going to be distinct. The problem students have in the laboratory is distinguishing the soleus from the plantaris, because they both fuse into the calcaneal tendon. Okay, so pay attention to that as you're doing your CAT. And be able to distinguish between those two. There's the plantaris right there that I mentioned on the last one. All right, now the last of these, this one, Annette, you want to help me one more time? Tibialis posterior. What was the telltale sign of our tibialis posterior?
The shiny one. Shiny.
Yeah, so this one, and you're doing your dissection in your CAT, this one is the muscle that is fused to the back of the tibia. The tibialis posterior. And it's got, the lab manual describes it this way. It says it's got a glistening, shiny tendon on it. And you'll be able to see that on that muscle fused to the back of the tibia. So it attaches proximal tibia fibula. Of course, it does plantar flexion. It goes to 2 to 5 on the metatarsals. Then the flexor digitorum longus. Flexor digitorum longus. Is there an extensor digitorum longus? Yeah. Okay, so what's the difference? Okay, we just say, what now? Yeah, you're right. They go opposite directions. Okay, one flexes, one extends. You see how it would be useful? Why don't we just call it flexion and extension? That's the way they name the muscles. But what do you really mean here? Plantar flexion. Extension means dorsiflexion, right, at the joint. Okay, and then the last one here, the hallucis, that's the big toe. The flexor hallucis longus goes from the fibular shaft. You see what I was talking about a minute ago? They like to cross. This one's on the fibula. What business does he have on the big toe? They all seem to want to go to the big toe. So the flexor hallucis longus is an example of that. It goes lateral to medial, from the fibula over to the big toe. All right. On Friday, anything is fair game. Perhaps it would be useful to motivate you, because students are motivated by exams, but they appear to be even more motivated by bonus opportunities. And so I will put, I think I should have one on from last year even that I can just make active. I'll put you 15 or 20 questions from last year's test online tonight. You guys go through those before class on Friday. Get a sense about how I'm going to ask these questions. And then you come to class with your questions. We can go through the quiz questions if you want, or any other questions that you have. And when you stop, then I'm going to be ready to go with test 3 material. So come to class prepared with questions on Friday.
Do you want us to save all of our questions for Friday?
Yeah, I think we'll be able to handle that. It's all fuzzy. This is the front of it. Yeah, it's back to the knee. Yeah. There's the patella right there. That's right there. Yeah. So that's anterior comprehensive, and that's lateral.